What is Botox? What is Dysport? Everyone wants to know exactly what these medications are. What do they treat? We're going to go through that. Me and my friend. Hi, I'm Becky Wilkins. I've been a registered nurse for over 30 years now, and for the last 25 years I've been building my business here at External Affairs Medical Spas. Our specialty is aesthetic treatments as well as regenerative medicine, and our goal is to bring you all the latest information on these topics. Please like and subscribe and share our videos, and be sure to put comments down below if you have questions about any procedures. In today's video, I'm going to be talking about what is Botox, what is Dysport, and what is Xeomin. They are all drugs that are considered neuromodulators, and they affect the ability for the muscle to contract. So they are all derived from the botulinum toxin, but no, you don't get botulism from having these injections. You'd have to ingest a lot of spoiled canned salmon or tuna or whatever the heck it is. So that's not what happens here. Each drug is manufactured slightly differently, but they all do the same thing. So basically what the medications do is they block the ability for the muscle to contract. So the drug itself actually, it blocks the acetylcholine junction. So where your brain says contract, the muscle can't respond, so it can't actually contract. So it is a temporary action, depending on how much is used and in what area it's used, sometimes lasting for approximately 3 to 4 months. So where Botox or Dysport is injected, it relaxes the ability for the muscle to contract there. Originally, before Botox was approved for cosmetic purposes, it was used around the eyes for twitching or cross eyes. And then it was approved for cosmetic purposes because it actually softens wrinkles in time. So the most common area, of course, is in the middle here, because this group of muscles, it pulls down and in. So when we inject in here, we relax and we get some elevation here. Sometimes when we do that, we actually get a little bit of a lift in the tail of the brow as well. Second most common area, of course, is the crow's feet, because this muscle here also pulls down and in. When we relax it, we get an opening. Third most common area is the frontalis, or the forehead. So raising the eyebrows up and down creates horizontal lines. One thing that's important to note with these procedures is when we're injecting, we're not actually treating the wrinkle, we're treating the muscle that causes the wrinkle. So when we're treating horizontal lines on the forehead, we're actually treating the frontalis muscle, and we're weakening the ability to lift that eyebrow up and down. Other areas that we can treat as well are the nasalis muscle, which produces bunny lines, like this. We can also treat the orbicularis oris muscle, which produces fine lines around the mouth from pursing, like this. And then, of course, there's areas like along the jaw. We can treat the masseter muscle, or we can treat the DAO muscle, which produces like a downturn here. We can also treat the bands in through here. We can also treat the décolleté. And now we've got a new little device called an aqua gold device, where we can use little tiny droplets that go right into the skin as opposed to the muscle, and that actually helps tighten the pores. So those are the most common areas, of course, on the face or neck that we can treat with Botox or Dysport. And then, of course, we use it as well for migraines, and also for hyperhidrosis, which is excessive sweating in the underarm, most common. And then secondly, hands and feet for it. And then, of course, we use it as well for migraines, and also for hyperhidrosis, which is excessive sweating in the underarm, most common. And then secondly, hands and feet. If you enjoyed this video or found it helpful, please hit the like button, share it with your friends, subscribe, and hit the notification bell. And don't forget to leave us comments or questions down below so we can get to know you better.